These are 5 things I did to reduce inflammation quickly when I was having a chronic pain flare-up. A little background. I have hidradenitis suppurativa, chronic inflammatory skin condition. That skin, the skin itself, the boil-like abscesses, I don't really get those anymore. Maybe, if anything, once a year, because I manage that with nutrition very successfully. However, I do deal with other inflammatory symptoms that I'm trying to figure out if they're part of the HS or HS adjacent or just a whole other diagnoses. But if you have chronic illness, you know how difficult it is to figure that out. My labs are very inconclusive. I digress. I've been in and out of doctor's appointments getting so much blood drawn to try to figure this out because the pain, like joint pain, discomfort in my body has been coming up more for me, which is weird because aside from using nutrition in the last, like a few years ago, I started taking low dose naltrexone for joint pain, which was helping me for a long time. And then about a year ago, I also started taking a compounded semaglutide, which was even better. I was like, oh my God, I have no inflammation. But about February, it was like, where'd it go? Like, I don't feel the benefit anymore, the anti-inflammatory benefit. So I have been on like research mode and symptom mitigation mode. My job is physical. I'm a private chef. I'm on my feet all day. I use my hands all the time. I like to stay active. My pain has been impeding my ability to do those things. And recently I was in a crisis. So the 5 things I did, which I believe really turned it around quickly. Number 1, I focused on nutrient density. Like, it's not just so much what you omit from your diet, but what I was adding in because I'm busy. So just like anyone who's busy, I opt for simple meals, quick meals, things that are just like, low lift. And I was getting a little lazy with my nutrient density. So I made sure to do soups, lots of soups made with bone broth, like real deal bone broth. I'm eating soup every single day. Also, in those soups, I'm doing like venison, different kinds of protein, organ meat blends, to just get all these vitamins like in. And still on number 1, talking about nutrition, omega-3. So making sure I wasn't getting seafood in at least twice a week, especially like salmon and fatty fish. This is really big. Prioritizing protein, omitting like any kind of processed refined, like foods and refined carbohydrates, just to really keep my blood sugar stable, and drinking lots of water. Number 2, no workouts. No going to the gym. I could not go to the gym. It just wasn't happening. Like, I went on a lot of walks. I did a lot of stretching at home, but no fitness classes, no high intensity activity because my body just couldn't take it. Number 3, sleep. A lot of sleep. A lot of sleep, and with like a million pillows between my legs and this and that, just to get in very comfortable positions, like sleep and rest, taking naps if I needed to, because just my body just really felt like it wasn't recovering. For regulating my nervous system, I was dealing with this like symptom of like all the skin on my body feeling like sunburn and tender to the touch, which might have been a reaction to the sulfasalazine that the rheumatologist prescribed me, but I really just felt like I had to regulate my nervous system because my body was freaking out. So deep breathing, meditation. I've literally been to like 2 yoga meditation classes in the last like 3 days. And number 5 is mindset work. It is really easy to wallow and to just feel really hopeless when you're feeling like this. And believe me, there were tears, but I like let myself feel the feels because they're important, but then really focused on action and moving forward and like knowing that I was going to feel better, and I think that that's the power of our thoughts are really important. So anyways, that's what worked for me. I have like a whole body of work on, nutrition to help manage chronic illness and lifestyle modifications and all that jazz. So if you want to learn more, stick around, or drop a comment and I can direct you to where I have these resources.